So, ma'am, we can start.
Yes, Pratibha, ma'am. Pratibha, start.
Yeah. Good morning, everyone. Myself, Pratibha, from JSS Public School, from Science Department. I welcome you all for this virtual session on dentistry. The topic is the future in dentistry, the skill-based healthcare. You are never fully dressed without a smile. I hope I'm true with the statement. It is said by Martin Charnin. A beautiful smile starts with healthy teeth, and for that, we need our dentist. So today we have with us Dr. Nandlal Bhojraj, our resource person of today's session, Professor and Head, Department of Pediatric and Preventive Dentistry. Sir, it's my pleasure to welcome you for today's session. A warm welcome to our parents and students also. A hearty welcome to one and all here, our teachers, faculty, non-teaching staff, everyone. So let's begin the session with a prayer song. I call upon now Miss Ghana to give her a prayer song. Over to you, Ghana.
Gajavadana Gananata Sukha Sadana Gauri Tanu Bhavana Gaive Punya Smarana Gambhira Gajavadana Gananata Sukha Sadana Vidya Buddhi Vedata Vedagamatirtha Adipuja Prashanta Modaka Priya Vinuta Gambhira Gajavadana Gananata Sukha Sadana Gauri Tanu Bhavana Gaive Punya Smarana Gambhira Gajavadana Gananata Sukha Sadana. Thank you, ma'am.
Thank you,
Ghana.
Ghana.
Yeah. Pranam to all gurus. Sri Shivratri Deshikendra Mahaswami ji, seeking his blessings. Let's begin our today's session. Over to you, sir.
Yes, yeah, I'll just give an introduction of sir, then sir can take over. Okay. Thank
Yeah,
you,
ma'am.
Pratibha, ma'am. Thank you. Yes. Dr. Nandlal Bhojraj is a professor and the head of the Department of Pediatrics and Preventive Dentistry at JSS Dental College and Hospital, Mysuru. Sir has completed his bachelor's degree from Annamalai University and master's degree from Punjab University. He has completed his PG diploma with SJCE Mysuru. Sir has been awarded with many awards on outstanding achievements. He was given a Brown Medal for standing second position in the Punjab University examination of MDS in Periodontics and Preventive Dentistry. Few of his awards in his baggage are the Bright Future Award, Ramachandra Oration Award, Star Pediodontist Award, Fellowship Award from Indian Society of Dental Research and IAPD BSBF Awards, and Baby Oral Health Program, and many more in his accounts. Professor has also held membership and position in various professional society to his credits. Professor has also held position in societies such as EC member, Indian Dental Association, General Secretary of ISPPD, Vice President of Indian Society of Periodontics, Vice President of Indian Dental Association, Vice Chair Autism Board, FSCD. Professor has also been associated as a pre-reviewer from various national and international journals. Professor has also been associated with many publications and has presented various papers. He has 110 publications and has served as guest lecturers both at the national and the international conferences. We are so honored to have you amongst us, sir. Once again, myself, Geeta Srinivas, welcome you on behalf of JSS Public School, HSR Layout. We are all waiting for your inspiring words, sir. Over to you, sir. Thank you.
A very warm greetings from JSS Academy of Higher Education and Research, Mysuru. As been introduced by Principal Geeta Srinivasan in a very elaborate way. So thank you, madam, for the wonderful introduction. And I also thank Pratibha for making this platform go with a welcome song and a prayer song by Jnana. And it was really impressive. And to meet at this virtual platform, children, I'm sure you are all excited. And that too, you're meeting a medical professional, that too a dentist. I'm sure that you all are at home, and some of you must be coming to the schools in this situation with all the, because of this COVID-19. I know how much the world has been restricted for you at this moment. And we know that we have always been enjoying the school life the best in our life. That even today, I would say in my own journey of school, you'll be surprised. It's 40 years now, which we have left school, but all our school friends still are now, because of this internet and because of this groups, we are able to interact with everybody. So let us take it positive that we are still in connection. We are all meeting you all, and all of you are meeting with each other, whichever mode it is, whether it is face-to-face in the neighborhood or it is in the school, whenever you're visiting on regular practical classes or on all classes. But I'm sure that there is all securities and safeties are taken care. Now, I don't want to take much more of the time, and let us, I'd like to share the slide straight away. We can see my screen, madam.
Yes, sir, we can see it.
Yeah, thank you, Smoke. And I'm sure here, this picture, a short picture, shows what we need to learn in a short time. And the best of best is chosen, as we can see here, to fly in our life ahead. And you need to be very choosy and understand everything critically, what you need in life. Particularly, school life is the time you get motivated by your teachers, by the professionals, by your neighbors, by your parents who guide you throughout life. And this guidance is very much required. You get to live a life in a flying colors, touch the sky, which should be your own. I thank the management of JSS Public School, and which is part of JSS, which is where we are also associated with. So the topic given is Career Connect and Professional Planning webinar series. But then I was discussing with madam, and she said, like, why not we do both? Like, we also, to make it more interesting, there is both to know about as a profession, what would be the future in dentistry and what is it all about? And to be putting it in a simple way, it is nothing but a skill-based healthcare delivery system. And it is part of health system. It is an equivalent part along with the medical. Okay, so we'll be running through quickly with the slides, which we'll be moving forward with, and telling you what dentistry is all about. But more interesting to that is I always give programs to the various schools in Mysuru, around Mysuru, both in the city and in the rural areas where there are villages, particularly the government schools. Not only we cover the JSS schools, but also the other schools. We educate oral health care. Why oral health care is important, we'll be seeing it shortly. And we have also conducted a virtual program at our JSS school, at international school at Ooty, and it was wonderfully attended by all the children, and the outcome of awarded with a great award in an international conference. And this type of mode is going to be part and parcel like any other education. Why should medical education, which was also supposed to be done face-to-face, and education classes should also be continued along with the education? So that is what both the things will be clubbed together now. So basically, this is my email ID. If you would like to contact me for any other purpose, whether you want to choose your professional career in the front, or you have any dental consultation required, any advice, we are available for you from the JSS. So I am based in JSS. Now, if you look at me, like before I even start about the career, okay, I always had a thought, what I should be. Should I be a teacher? Should I be a health worker? Or should I be a scientist? So normally all these type of extremes will be bubbling in the minds, and we always have a role model. This is the age, children. I'm sure you all have some role model. You want to be like your father, or you like to be like your mother, who's in the professional front, and they are your role models. And then you also have guidance from the parents and say, this is our, professionally, this is having a scope, and this is having a much more capacities that we can afford to, and establish an industry. You want to become an engineer, so we can go for into a different type of a world. So these are all the inspirations which come from the family, as well as the teachers, family members, who guide you through this time. So I'm just going to talk to you. If you're going to be a healthcare provider, if you want to be a healthcare provider, and if you would like to choose dentistry, what is this dentistry about? In medical healthcare, there are many more areas, like there is also a typical medical doctor, which again has got a wide range of specialities, which I will not be covering up now, but there is an equal branch which is called as dentistry. Now, the advantages of dentistry, why dentistry, also we'll go into the different slides. And then comes to the other field, that is pharmacy. Pharmacy also is a health-related program, which I'm sure subsequent lecture educative programs will be arranged at your school, so that you would know what are these three major divisions of healthcare delivery system. Besides that, there is also a lot of BSc, MSc programs dealing with laboratory procedures, technical procedures in healthcare, nursing care, all these type of cares, physiotherapy, speech and hearing, are varieties of medical healthcare. And today, the age span has increased. In the past, of course, anybody would like to say you'll have a long life. And today, because of the healthcare, healthcare has improved so much. The lifespan has also increased in almost all the countries, including developing countries. So there is a great scope in healthcare, as a healthcare provider, and to serve the society. And of course, you may say, yes, in the professional front, besides service, it is also, you need revenue, and it generates enough resources to you to sustain and develop your career, as well as your profession, as well as your living. And the aim is to serve, but at the same time, yes, resource generation also is today. You can see the number of corporate hospitals opened. Okay, so with this introduction, though that we have also going to discuss on the primary preventive dental health care education system. Now, before I go into the actual course detail and the need of dentistry, we would like to put you with a short video, so that we can, Sumuk, can you just, I don't know.
Sure, sir. I'll share the video on your behalf.
Okay, yeah. Beautiful campus. It's housed in Mysuru. Campus is on all three levels of programs: medical, dental, and pharmacy. Students all over the country, and also
It has been a very strong platform. It has given me a lot of opportunities.
Dental facility here.
We train the students not just only in the clinicals, but also on how to work in the laboratories.
Our teachers and faculty, everybody has been so supportive.
Dentistry is a course which deals with varieties of skills here. A lot of artwork, paintwork, fashion work, beauty,
I've never felt like a foreigner.
sculpture.
Around 500 patients per day visit the JSS Dental College.
This is our clinical area, spaced and well-maintained, ISO certified hospital with all strict sterilization system, and you feel safe providing dentistry. We also have a mobile dental service.
The research microscope has additional attachments like the phase contrast microscopy, dark field microscopy, fluorescent microscopy, and image analysis with camera attachments.
Read histology. So even in the medical and dental, both you have a lot of surgical.
We are able to treat the patient at the lowest cost.
This is a pediatric dentistry, which we call it as pediatrics. You can see how comfortable the children are. Here now you're seeing the overview view of children.
Children, of which JSS Smile is one of the focus areas.
Service where all of us meet. We have research facility in dentistry. People who are interested to carry forward as a scientist in the medical health also, you can carry forward.
Collections in our library.
The environment of the hostel is really good and we feel secure here. Providing each and every day healthy and hygienic food for us. Our university has provided us with many sports facilities and gymnastic facilities to maintain our fitness. To be the best, choose the best. Choose JSS Dental College and Hospital and feel the difference.
Really have pleasure, and it's our faculty who are supporting them complete your dreams.
JSS
With a positive inspiration.
look for graduation and post-graduation by many students.
JSS Dental College and Hospital is a extremely wonderful facility for the students and also for the patients to get the best of the care.
I hope you all enjoyed the overview of JSS Institute. So you are most welcome whenever you visit Mysuru for a holiday or a weekend, you can always come to our campus and they will allow you inside. You can also come for healthcare treatment service utilization. You really have hands-on experience here and your personal experience. And you'll see it is not less than any other international hospital which you see. I don't want to compare to India alone. I don't want to say India, but you could see the images, the setting, the care. I do not know, most of you have visited locally to the local dentist, or you would have visited to some of the local dental colleges. You can rate yourself what JSS is by looking at this video, but not only the video. When you come here personally, you'll really see that you're in best hands. both for training, undergoing studies, and as well as oral health care for yourself, you're most welcome. So we can proceed with our next part of the presentation. Yeah. So you can see that the wonderful campus which you saw, it had both medical, dental, and the pharmacy, because we have dentistry is not only dentistry, okay? You still will be having some subjects which you'll be covering up from the medical as well as pharmacy. So most of these courses have a blend of all the subjects so that you become totally equipped for giving oral health care, okay? And then besides lecture classes, the students are engaged in small group discussions with a mentor and a teacher, both in the clinical or whether it is a lab. So because the number of students admissions is 100 per year. So it is, when you take a class for 100, whenever it is a professional course, there is a lot of visual and actual hands-on. You need to see some of those specimens and some of those objects which we will be keeping for education models. So they are always done in a small group so that you can see them and visualize them with a better understanding. So I'll be taking you to the journey of JSS Dental College, how Dental College had started. You all are very familiar being in JSS institutions, that is JSS school. But just to make sure that people who are others who are newly joined the school, that JSS is not a new organization. Its existence has been in many years ago with our vision of His Holiness Swamiji and present Swamiji, who took forward that not only this, but also education is the most important to sustain in this today's world. So inspiration and the mission of Dr. Shri Shivratri Rajendra Maswamiji and the present Swamiji, Shri Deshakendra Maswamiji, took forward this spiritual focused organization and their mission from 1954 to provide education, not only to go into spiritualism and provide help to the people who are in need, but also education. And thus started with many institutions. And from the website of Mahavidyapita, there are 300 plus institutions and 10,000 plus employees in 50 and the various schools and colleges of JSS Mahavidyapita, not only in India, but also we have recently about more than 5 to 8 years now with international platforms as well. And yes, such a big organization, and we are wanted to know, and people always try to tell, and our Swamiji always said, why not we go ahead with our own university? And it was in 2008 when of our Swamiji had started with this going into the form of a university where the 4 of the institutions, the medical college, dental college, and the pharmacy college, one at Mysuru and Ooty, which are also having international recognition, all came into the umbrella of the JSS university, which was constituted. We had a time to time, the university later was coined with the name of JSS Academy of Higher Education and Research, because as per the terms and conditions of the UGC, the university was retitled again, the deemed to be university, and it is today been known in the website as JSS Academy of Higher Education and Research, which you can go into it and see its profile. Strategic planning is always in place, which is much more focused, as you can see in these pillars, which support to provide excellence in education, which is value-based education. So the which you saw in the campus video just now, and all these campuses, I would say, are very impressive class of infrastructure and definitely to meet all the national and international standards and the requirements of apex bodies. And you all know that being in the school, how well planned your school is, very spacious, well ventilated, well hygienically maintained. I'm sure when you compare yourself, you feel proud that you are in a best institution, in a place wherever you have joined, in particularly at JSS. Now, coming to dental college is having a history of more than 30 years now, more than 30 years, exactly 35 years it is of its existence. It was started in 1986, recognized by the Dental Council of India and the Constituent College of JSS University, as I told you, in 2008, and now called as JSS Academy of Higher Education and Research, and it is an ISO certified hospital. Now dentistry, if you are thinking it is only a dentist, no. Just like in medical doctors, you all know in medical doctors, there is an eye doctor, there is an ENT doctor, there is a skin doctor. I'm talking in common language so that children can understand. I'm not using the scientific words. Okay. There is also in medical, there is a surgeon, there is a gynecologist. So like this, there is a medicine, general medicine, there is a pediatrician, specialties in the medical side. Similarly, even in dentistry, yes, you can stop your course with just dentistry, like this base bachelor's in dental sciences. Okay, and you can practice very well. Okay, you can practice very well. I would say 7 practitioners in any city, any leading city, are just with a graduate degree itself. Okay, now, but in the medical, you need to do super specialty. That is a must. Specialty. The type of patients who come for serious problems would be lesser. But yes, in the past, in medical profession, there were with just a medical MBBS MBBS degree, which is meant for medical doctors. They were used to take care of health. Yes, they are knowledgeable, but today, go to a specialist. But in dentistry, still a common, if you want to stop your career, with your academic completing course just with a BDS, yes, you can do you can settle down with practice, your own independent practice, and you can earn and serve the particular locality. And but coming to that, if you have an interest to further super specialty you want to do, there are 9 branches, including oral pathology. So like, you want to be a pathologist, you actually wanted to be having little interest of medical, a little interest of dental. So, and you still wanted to do something related to medical, there is some branch which calls as oral pathology, even in dentistry. And similarly, there is a course which is called as surgery. Even in dentistry, you can do a super specialty of surgery, which we'll be going through shortly. And we have got experienced senior professors here. Let me tell you, all these professors I have been working with for the last 25 years. So you can understand, now that you know that India has got so many hospitals, so many colleges, and so many medical and dental, and that too private, in a government position, there are always doctors permanently in there. But in private colleges, the number of job opportunities were so much. Many of these faculty teachers were never staying in one place. They were going everywhere. They will be for 1 year in one college, and next year they will plan to another city itself and start moving. Maybe for the sake of whatever reason, maybe location due to the marriage in the family, they are or mobilizing for the better life from one city to other, because some of the colleges were in the rural areas, some of them in the city areas, and some A class and B class cities. So whatever, and then financial. They wanted to have a better practice, they wanted to have a better income, but JSS has been one of the, as you know, dental college has been in one of the wonderful cities, capitals, one next to the Bengaluru, well connected to the train and facilities. So not only that, the JSS Dental College has got wonderful facility. There is what we need for providing care to the population. All those equipments, infrastructure are there, available, functional, and maintained very hygienically. So all the faculty are, and that is what you want to know as a learner. Now, as I told you that we have 100 admissions under undergraduate program. We have master's specialty program is 32 seats only per year. And we also have diploma course and also PhD scientist in the medical care? Yes, today it's possible in India. In the Western countries, there is a PhD is a compulsory if you want to be a researcher. But in India, research has become recent, and that in JSS, only in dentistry, we have 25 PhD students at this point of time. So, and this admission is numbers showing that in the various specialties, every specialty we are having a master's program, and it depends upon what you want to be. You want to be a total dentist, or you want to be touch-based with a little bit overlapping with the medical care. So dentistry is not just about tooth. That's what we'll be seeing that shortly. And as I told you that professors, readers, and lecturers are the teaching resource faculty here. And all these designations, you'll be interacting. All the teachers will be engaging you in the classes, as well as in practicals and clinicals. And all of them stay here for a long time. And yes, any hospital, because we have got a teaching hospital also, and without the support, we cannot deliver good care. So there is very few colleges have got such supporting staff. And I would say, again, that is very important so that you all get trained. So coming back to in short, there is a proper system. Now that, okay, you think, okay, now an independent private university, are we so relaxed? No, you will be provided the best of the teaching program. It is being monitored with all the regulations. The Board of Management has got various boards here, Academic Council, there is a Board of Studies, departmental meetings, student feedback, and review and feedback and implementation. So the faculty has to work all the best here. Okay, so just because it's a private college or it has become a private university now, so don't think there will be any compromise in providing you or being monitored. Will be much more seriously monitored. As you know, in the newspaper release, you know that JSS University has been recognized as the top university and 10, and most of the institutions, the medical, dental, and pharmacy are also in the top 5, and some of them are in top 3 among the rated in the country. Now, I told you there is always a feedback, there's a monthly audit, and there is a assignments, logbooks. You may think, oh, we end up with the school again, we have to go through all this. Yes, today's regulations have made that it is, though you think that once you join a college, you will have a lot of relaxation, it's left to you whether you want to read or whenever you want to read. No, here again, you have system here in place now. System has changed even in this higher professional courses, as well as I'm sure in any other arts and science course also. Today, the regulations have changed. You will be audited for your monthly activity. You will have regular assessment exercises once in 3 months and once in 6 months. And there will be a cumulative marks given, which will also be added up as an internal assessment. So you have your bonus marks of 25 in each of the subjects. So these are the various IT-enabled teaching. So yes, all these years you are reading only from the book or from the notes, but here you will be provided. And no, I know that in some of the schools now we have, and now presently from the 1 year you are used to the internet teaching, webinars, virtual teaching. So you will have similar models here, various locations where you will have all the facilities. There will be skill labs. Yes, dentistry is about skill lab. Yes, as a medical care, you have a lot of theory. Yes, you will have a lot of practicals also, but there you will be learning when you complete the course. You will be actually performing the surgery. You will be an observer. Whereas in dentistry, right from your first year, your dental subject starts, where you are going to be trained in skill. So even if you may be a good painter, or you may be a good in carving vegetables, or things, or you may be liking to make some toys, create toys. So all those features, all those skills, you will be using this forever in this profession. Dentistry is all about skills. So besides the surgical, it is not that anybody will be molded easily and trained, because sessions and each subject has been trained. So all these facilities are available. There is a video conferencing, there is a camera viewer, recorder. There are various projections. Even the smallest area can be projected and you can visualize it better. There is also patient care management software, And of course, we have a smart classroom like what we are doing now. You can access anything, anytime, anywhere. He's our former dean. Present dean is Dr. Ravindra, whom you saw. So, so these are the various labs which you saw. So you don't have to be afraid of. Yes, sir. Teeth setting is there, and you know what is something called as filling procedure. There is a, you can see this is like a model, just like a human body. So we have a system here in the laboratory where you will be practicing everything, and only then actually going ahead doing it on the patient. So and it's a full 1 year training on, not on the patient, on a simulation labs. So whether you are doing a filling, whether you are doing a root canal, there is a root canal treatment. Even though this is a student here, you can see how confident he is. So besides that, there is always an exposure, not only within our university, we also permit the students to go and visit other colleges, attend workshops, seminars, and conferences and meetings. And also we have got faculty enrichment where some faculties have been given opportunity to visit other universities in the country as well as in abroad. And some of the faculty who have gone abroad and brought back additional training to be delivered to the student. Now coming to we are in a hospital service. So if it is, the training is that students should get an opportunity to see variety of cases and also get an experience to have self-practiced on the various procedures he has learned. You can see here the number of patients who are seen now in our hospital visit per year. Way back in 1997, we had around 50,000 plus patients visiting per year, and it had reached to almost 100 lakhs. 50,000. It reached about 1 lakh patients visiting per year. So, and that is a wonderful platform where student is feeling confident when he goes back and starts practicing. And so on an average, around 400 patients per day. It's a bit, and this 400 patients means we have, as you know, we have 9 departments. So every department would be approximately treating about 100 patients. So it is a wonderful platform. The students who are going in the 3rd and the 4th year, they visit, they are posted in the clinical exposure and they get trained. Now, it is not only about hospital care in the hospital setting. We also go to the rural areas and people who like to do public health care services. We have one of the subjects in the, which is in the 3rd and the 4th year. You have a weekly 1-day visit to the various satellite centers. We have in Suttur, our founder's place, JSS hospital, where we have an excellent clinical facility, both for medical and dental. It is one of its unique models, which is almost equivalent to any of what we have in the Mysuru city. So even a rural population is getting the A-class facility in healthcare, particularly with the oral healthcare, which is unimaginable experience you will gain in our center. Also, we have got baby healthcare, and we have a cleft care where the JSS Smile, it builds this in the children who are having a defective lip. There's a free service provided by our present Swamiji, JSS at JSS Mahavidyapita, our president, or Sri Deshikendra Swamiji. We also have services provided to the various government bodies, employees who come from RMP, TVS, and KSRTC. You will also come to know occupational-based dental problems or medical problems in them, and how we take care of them. So we also have an international tie-ups where we have collaborations both in the form of research as well as a resource faculty. Our faculty also goes and provides some amount of assistance. Now you saw this beautiful campus, out of which the dental college alone has got 6. You can see the various areas specified. It's a spacious, very well spacious square meter area. As you can see, it is 16,548 square meter. It's about 180,000 square feet. It's one of the largest dental colleges in the country. And there are these are some of the few equipments which are highly advanced equipments are listed here, which you will have exposure when you are going to join the program here. So these are the same facilities. We are just showing that you saw in the video. So this is how you will be trained. There is an ergonomic position. Ergonomic position is how you examine a patient. There is all this training will be easy, not to worry about. There is working clock that's called as where do you stand and work. You have freedom to work for 180 degrees around the patient, and your assistant works around the other side of 180 degree. And it is a 4-hand dentistry today. Yes, but in the past we were doing two-handed dentistry. That is you yourself. But today with the modernization, you can train your assistant or have a nurse if you want to have a nurse, or a trained person, because Indian regulation is permitting that even a trained person can help you in assisting in your procedures. And you can see such a beautiful dental chair. Yes, you may be thinking of expenditure point of view. Let me tell you, when I started, I bought a chair which I could invest only just 25,000 rupees. Yes, you have A-class today with the digital world. So what I invested was something simple like this. But today you have a digital screen and digital model. Yes, it may come to around, you may have to invest on the dental chair with all the accessories. You have a dental X-ray machine also you can be using as licensed to be kept in your practice, and you can provide service and generate income, and a digital system of documenting and keeping the records. And yes, this type of a setting would cost you something like 2 to 2.5 lakh. So it depends upon what you want to do. You want to straight away hit, or you want to start in a rural area or in a competing area, whether you need all this setting. Yes, on an average, even with 1 lakh, you can do justify. And here you can see that on the top right extreme, there's a microscopic way of dealing and treating the children, or that some of the procedures, particularly which is called as root canal treatment, or very difficult to access areas. But this is an additional requirement, which is not mandatory. This is like a super specialty. So, and you can see the team of people who visit us and cost appreciation. And we have a very, very systematic standing operating system for sterilization. This is a separate room dedicated where centralized way of all the equipment. So instruments are washed, disinfected, and packed and sent for the sterilization. So you will feel safe. Now, in the COVID times, many of you got scared that, dentistry is going to be, it's going to be deadly. It has got a lot of aerosol. And as a patient also, you're feeling scared. No, you don't have to worry. All the care has been taken. Once you are in a PP, and you are provided PPs when you walk into and walk out, and there's a proper system of sterilization, and no crowding in the hospital in between appointments. You are safe to undergo dental treatment. Yes, you have to choose the setup where you are going, where all this is available. Yes, even the private practitioners also are doing this care because they have to protect themselves too. So once you know the system, how you need to take care, then how they are managing in the medical care. Even in the medical care also, patients do come with COVID fear, and that doesn't mean you should, for that reason, you should think twice. It is, if you follow the safety measures, you are safe as a provider or as a utilizer or as a consumer. Now, coming to the most important aspect, the library. Yes, you have been buying books in the school, but in medical courses, yes, if you want to buy some books, yes, you can, but it's not compulsory because you have a wide range of collection in the library, and there is a circulation also. It is being issued to the students. They can keep it for a specific period of time and you can return it. And we have enough number of copies, at least minimum of 10 copies of each edition will be there for the last 20 years. So you can always see there will be any point of time, there will be 30 copies on a particular subject, which is most often used. And besides that, we also have journals, particularly for the program, which is master's program. I'm sure some of your family members must be doing dentistry. If they are in dentistry, if they are choosing your master's program, they can always come to our institution. So as I told you, there will be attendance is very important here. You'll be monitored for your attendance, and your from the time of admission, there'll be counseling report will go. Yes, you are going to leave your home and come back here, but you will be not lesser than any other home because you will be watched more than your parents here. Okay, both in the campus, in the college level, or whether you are in the hostel. Everything is monitored and reports will be generated and communicated in the form of digitally now. Otherwise, we used to send by post in earlier. And so that's what I said, your life here will be monitored and you'll be provided care from all these administrative positions, which you can see. So needless to say, we are not, you can see time to time that JSS institutions and careers in dentistry, who's been doing well, JSS being rated, as you can see here also, and many more. This is not a latest news, but it has been there from a long time, and even now we are in the listed in the top institutions. And our faculty have also been recipient of many national and international awards, and they are also been authors of various books. So we can see here the various books published from JSS Dental College. Similarly, the JSS Medical and Pharmacy also have large range of publications.
Sir, it is not audible. If you could just tell in brief, like.
Yeah, so here she's our director, deputy director, Dr. Dakshani, and former vice principal who has been working during my principalship. So she has been interacting with the feedback system. She maintains a feedback system. You can see even international, both are international students, and they have been given also equally, we ensure that if an international student is satisfied, that means you can imagine what an Indian student also would feel. So they are proud to have been with our JSS institution, and they learned quite a bit of all clinical material as well as the skill-based program. Okay. It got, yeah, I think, yeah, so make your future with JSS University, and you're most welcome. So with this, we complete the orientation towards what dentistry is about, but I have a small presentation, few more slides to take you through. Sorry. So I would like to just again reinforce now, what is the role of dentistry in the global health? You'd like to know that what exactly is happening there. Yes, dental problems are still very high. Though the dentistry as a profession is more than 50 years old or even 100 years old, but in the last, say, I have seen 35 years of 40 years of my dental experience in this country. And I would like to, I was telling you that my journey has been at JSS. I joined here as a lecturer, and I saw the dental problems, how they were in this region. And it was quite, though it was quite high, patients were not coming for treatment because maybe they were, the type of treatments available in the local region that time was only conservative. Like, you may think, oh, dentist, you go only when there is a need of acute problem, like there is a dental decay or there is something like very badly paining tooth, or you want to get the tooth removed. So people used to go only for emergency care in that times, though there were dental problems very high. And the number of dentists available were very, very less that time. And now, yes, the question comes, is the dentist, because of that so many dental hospitals started, dental colleges started. Now, do we have enough dentists? Do we have enough workforce? Is a question. No, we are still not enough. We still need, because even in a lifetime, if I want to treat my particular locality or city, and if I am focused, I don't have time to treat more than 10 patients in a day. Because in dentistry, you need at least a good treatment. If you want to do, you need about 30 to 45 minutes. It is not like 5 minutes where in the medical care, you can do a checkup and send them. Yes, but it's equally rewarding when if you are talking about resource generation, it is equally the charge of the treatment is high. Okay, so though we treat 10 patients in a day, if you have assistants with you, yes, you may treat 20 patients a day. So even in your lifetime, even if you work and calculate your work and time management, you will not be able to deliver care. So that means even in spite of there is an increase in the number of colleges, number of dentists, still there is a good scope. And that is because of the inequalities. Now, because what is the inequalities? Because the patients are not able to access a particular region. So wherever you are, they have to come. Because of this inequalities, if you go to that region, there will be possibility. And if you see the global burden of the diseases study, it shows in the last 3 decades throughout the world, still there is a need and remains the major global problem. That is, oral health conditions are still in the last 3 decades still, though there has been increase. And similarly, if you see, there are more than 3.5 billion cases with oral conditions worldwide. Still, this is the latest report which we have. Okay, so now what is the focus of WHO? The WHO is the World Health Organization, which also focuses and create and which may lead the way forward. It tells us what we should do for this type of a condition. It builds coalitions with the relevant external factors and creates an inclusive and unifying global oral health network consisting of dental and non-dental members with good representation from all parts of the society to reach the consensus on how to address a problem. So here, and not only that, various other health organizations like associations also plan and propose to monitor how to reduce this burden. So even WHO keeps dentistry is a part of goals of healthcare under the of the World Health Organization. So, and let us look at India. In India, right, say when 30 years ago, we had one dentist per 30,000. One dentist per 30,000 to serve, which is, again, as I told you, it is just impossible. It is just impossible to treat such a level in a time you have in your lifespan. So that is why there are more dentists required. And in India alone is the second largest producer of dental graduates, with more than 24,000 new dental graduates adding to the existing number of dentists, but still there is a scope. So whether this current situation will create an oversupply or undersupply in the next 10 years is still unknown. But yes, if you try to concentrate and want to live in the same region, and next, you want to start in your own road or where you have a house and where there are already 10 clinics, yes, you will be competing with the other established clinics. Yes, but if your center is going to be big, but otherwise, as you go, as the city is growing, similarly, there are 50% of the clinics can always go to the next level. Now, in India, again, there is an apex body which is called as Dental Council of India, which, though there are so many colleges started, it is not like just a college is started and they're left there and it's easy to run, or they are always monitored. So the Dental Council of India maintains a uniform standards of education that all the students get good training, and they have regular inspections, and they come to us, our institutions, and monitor whether the students are getting completely trained and whether they are having enough number of patients. And let me tell you, you can see the statistics here. The number of colleges existing. There are 315 colleges in the country today, of which we are rated number in the top. You could see that we were in the number 2 or number 3. Obviously, the government, some of the government institutions like All India Institute, and you can say some of the institutions like PGI Chandigarh and Mumbai or Lucknow, one of the first dental colleges, they are all always best performers because they've been established for more than 50 years. Now, coming to the dentistry, as I said, it's a science devoted to oral health. It deals with the diagnosis, that is identifying the disease, treatment, and prevention of oral diseases. Dental professionals provide oral care from cleaning the teeth to more advanced and specialized procedure. And cleaning doesn't mean just, we have ultrasonic equipments, ultrasonic way of, it's a machine made with the works on a vibration, and a drill, which is, there was a conventionally in the olden days, there used to be a drill which rotates with a motor driven. Today we have a drill which cuts the teeth or prepares the cavity, removes the cavity with an advanced tool which works on air turbine principle and air compressed air under a water coolant. So it's become so comfortable. So it is not scary at all, whether you are going as a consumer or you are going to be a health provider. And you don't need real muscles. Like if you think, oh, tooth removing, pulling out of tooth, or you call it as extraction of tooth, is the very difficult task. I don't think I can do that. No, it is not that you are pulling out the tooth. It is the lever mechanism. You know what is a lever is? So where there's a load, okay, and there is a lever and your working end. So it elevates the tooth out of the bone very easily. It's a lever principle which is involved. So you don't need real muscles to be with you to become a dentist. You can still choose your profession as dentistry, even if you are thin and built. Now, coming to the subjects here. So as I told you, you are 50% almost having the knowledge as a medical doctor. Medical doctor means those who do MBBS. You have basic subjects in the first year, which is called anatomy, and then physiology. And then, of course, you also read dental anatomy and histology. Then in the second year, you read pathology. We are talking of general pathology here, and general microbiology, general and dental pharmacology, dental materials. These three subjects, dental materials and preclinical subjects like in conservative, that means deals with how do you fill the teeth, and prosthodontics, that means how do you replace the lost teeth. These are the simulation labs which are trained to you right from the second year. So you build confidence right early. And all these will have both theory, practical, and viva voce. Viva voce is something like, we ask you, once in a way when the teachers ask you a question in the class, but there is a separate session which is called as viva voce. There will be separate marks for this. And it is very interesting and way to recap and answer. And all these examinations will have short answers, long answers, as well as now we have introduced, as per the apex body recommendation, MCQ examination also. So it is not that difficult, at the same time not very easy. But if you're a good reader, good learner, and you have good teaching facility, any institution, I'm sure you will do well. Though the subjects look like a very big list of subjects, but you don't have to worry. Now, coming to the third year, yes, you also have basic exposure in general medicine and general surgery. These are the main subjects for the medical doctor or MBBS courses, besides the other specialty clinical training which they undergo. But as a dentist, you are also supposed to have some knowledge about general medicine and surgery, where you will have both theory as well as hospital visit. And JSS, is having one of the biggest hospitals today in India again, which has got 1,800 bedded, highly equipped with 24 operating theaters and A-class facility for wards, where even a rural person feels that he's in one of the corporate hospital feeling. And so you will have a wonderful experience at the JSS hospital for this particular training as well. And the number of patients there are so high, you will see, most of the patients here will come from not only from the rural area, but city. So you will have variety of experience here to know the conditions in the general medical and the surgical care provided at the JSS hospital. Then, of course, as I told, oral pathology and an oral microbiology is similar to that of general pathology and microbiology, but here we will be teaching only about oral conditions. Now, coming to the final part, this is what you're going to practice in your rest of your life. There are eight subjects here. I said 9 specialties, but out of the 9 specialties, the 9th specialty, that is oral pathology, is covered up in the 3rd year itself, and it remains as a part of a laboratory and diagnostic purpose. So you will, in your general practice, day to day, you will be practicing this. So what are these specialties? We will be seeing it shortly. And the 5th year is of internship. Internship is compulsory now. It's a 1 year where there will be no examination, but you will be attending to the patients and learning much more advanced care besides what you learned during your 3rd and 4th year. One interesting thing is in dentistry, right from 3rd year, you are going to be treating the patient right from 3rd year. Now, what is its specialties? So as I said, you can just be a general dentist after your BDS, but yes, you can become a super specialist by doing advanced further course of a 2-year program that's called endodontics. And then another one is periodontic. Endodontics is dealing with the root canal problems, root canal whenever there is an infection, and periodontics is dealing with the gum disease. Oral pathology is dealing with mucosal lesions and as well as gum disease. Prosthodontics is replacing of the missing teeth whenever a tooth is lost due to when we remove out a tooth, or when due to the accident the tooth is lost, or due to some other reasons like tumors. Then we give them an artificial teeth. Today, the artificial teeth has become a big specialty. It is just not just removable type. They will be permanently fixed, even using implants, which is the highest order of keeping the structure in place, reconstruction and rehabilitation of the lost structure in the mouth. Okay, you would have thought of replacing artificial limbs. People who have lost hand or feet, they have artificial. Similarly, this prosthodontics deals with the replacement of the lost structures in the mouth. Orthodontist is all about making the teeth look in a beautifully well-aligned manner, wherever there is irregularity of the teeth. Oral surgeon, I have put common words here so that you can understand, but it is also called as oral maxillofacial surgeon. Okay, now if you are still, you thought, oh, dentistry is all about mechanical work and all these things. I wanted to be a medical doctor. No, you can do great surgery. You will become a maxillofacial surgeon, where not just tooth removing, you will be treating various other conditions, like, there can be swellings, large swellings of the face, or there can be tumors, there can also be accident cases where there will be fracture. You have heard of a fracture of the hand and the feet, and you're going to the orthopedician or to get the fracture of the bones fixed. Similarly, there is a fracture of the facial bones. It occurs in most of the roadside accidents, or in sometimes in the aircraft, or in the train or in the bus. Very rarely so those type of accidents, besides dental diseases. I am not trying to scare you, but if you have got the passion, you can still be a super specialist and dealing with the most challenging specialty of maxillofacial surgeon. And pediatric dentistry, just like a general pediatrics, where they treat for cough, cold and fever and other medical conditions. Similarly, in dentistry, there is a branch called pediatric dentistry, which we treat children up to 12 years. Treating children is a challenge. You all know, you all have been always children, and so far, and you know what all your parents try to take care of you. And not that it's difficult, I would say, but we need to treat you that the way you like it and the way you understand and accept things, and you have a special care dentist for this, okay? And I happen to be a pediatric dentist as well. So I just told you what are the specialties. So what these specialists can do. See, this is dentistry before and after. You can see that that's a bad teeth here, okay, because of the decay, and this can be converted into a beautiful smile like this. This is a gum condition, periodontology, periodontist is a gum condition. You can see a lot of deposits here with the ultrasonic vibratory device, which is called an ultrasonic scaler. This is clean before and after. Similarly, you can see irregularity of teeth and dentofacial orthopedics. You can see these are called as braces, which are put, and this kind of a or irregular condition, you can call this before treatment and after treatment, how he looks. Then oral medicine is also just like general medicine, oral medicine and radiology. There is a specialty. You are going to be trained on how to use an X-ray machine. Okay, so you can also, whereas in medical care, if you want to start a medical radiography center, you have to do a separate course for this. But here in dentistry, besides doing dentistry, you can also keep a radiography machine and you can deliver service and develop resources. So, and also in oral medicine, also you deal with some of the problems like, difficulty of opening mouth, diagnosing various conditions which are related to vitamin deficiency, tobacco related conditions. And as a dentist, you will be able to take care. And this is what is a surgical care. I said we are just showing you a simple photographs here. I'm sure they are not very scary. We have had to choose very simple pictures so that because it is available for you to access this again later. So here the tooth has been removed. This is performed by a surgeon. Yes, as a surgeon specialty, but also as a general dentistry, you can remove with an instrument. There is a stainless steel instrument which is used. It's called as extraction forceps. I don't want to show all those instruments here. And we said prosthodontist is a replacement of teeth. You see, a person does not have, you can see the lips are falling back, that he doesn't have teeth there. He had lost all his teeth. And here you can see teeth. This is an artificial teeth which are made up of acrylic, which is a polymer. Okay. It's a highly biocompatible material, which is does not cause any reaction to the body. And this is a removable type. Same thing can be given fixed type. And here you can see one person has lost the front tooth, and here it is a replacement has been given. So you will be building up confidence. Imagine, and this can happen, this loss of teeth can happen in very early age of life also. And it is no, and today, even the age of 50, 60, they want to keep their smile in place, and they all want care. So it is not only the oral health care for the very young people. Young people will have different problems. With advancing, they will have different problems. So you have a wide range of population visiting to you and getting treatment. And here is an advanced condition of cavity where you see this before and after. Such a beautiful filling. This is a aesthetic cosmetic filling. In earlier, you would have heard silver filling. Some of you must have undergone fillings. That must be the silver filling, but here you can see it is a cosmetic filling. And if it is very much advanced and it is gone for an infection, the specialist, the conservative and endodontist, I just introduced you by terminology just a few minutes back, there is a procedure to treat the roots. You can see this white material getting filled up into the root portion of the tooth here. And it's comfortable. And then lastly, I said oral pathology is a microscopic way of looking at the conditions. It's a specialty, and public health dentist is going and providing care in the various schools as well as and in the rural population in the form of camps you can serve. So with this, we complete the thing. So what is the benefit of choosing? Yes, you will be the boss. Life as a dentist, yes, you will have a better understanding and interpersonal skills, and you need to work for 8 to 10 hours only per day. Yes, we are not trying to compare ourselves, but amount of workload for you will be lesser. And like people who want to say, oh my God, medical profession, doctors are always 24 hours, they are on duty, medical doctors. Dentistry, yes, if you become an oral surgeon, yes, you may get calls of emergency due to accident and thing. But if you are not going for oral surgery as your super specialty, doing a dental dentistry, it's left to you whether you open your clinic for 4 hours or 8 hours or 10 hours. And there's no restriction for that, but it's only your choice. So I'm sure dentistry can be of a person who loves skill and wants to work with a time-bound service and still be in the health circle and provide and serve. Dentistry could be your choice. So choosing career is one of the biggest decisions to be taken in your life. Before taking the final decision, make sure that you are confident about the path you choose. If you want to know more about dentistry, talk to a dentist in your community more, and more you know about dentistry, the better you will feel about your decision. So best of luck for your future when you choose your next level. And I'll go back to my last 5. I think, can I take another 5-10 minutes, madam?
Yes, sir.
Yeah, so now coming to the last part of my talk, that is, we have developed a virtual program on primary preventive oral health education. The previous slides must have already been given you an insight about what dentistry is about. This program, we have been doing that to Ooty and in JSS Sutur school regularly for the last many years. And now that we have started with Bangalore, I'm sure we can continue this. So these are some of our credentials, as you can see, listed below. The JSS University of Academy has rated very high, and our patrons, greetings from our Pro-Chancellor, Dr. B. Suresh, Vice Chancellor from Dr. Surendra Singh Ji, Dr. Manjunath, Registrar, Dr. Kushalappa, Director Academy, and Dr. Ravindra, Principal of Dental College. So now I'm going to run through very quickly. So children, I'm sure you're waiting for this part. And I'm going to talk to you in the next few minutes. It will be more like a child talk. And I'm sure you will enjoy this. So what is Partners in Prevention? Partners in Prevention is always a role of, we always think, we say, who has to take care? Who has to take? It's the parents and the dentist. But without you, we cannot complete this. So it is a triangle, and we need to understand each other very well. It is not that we want to restrict you from what you should do, what you should eat or not eat. Now, like we say, you brush your teeth, and it's not an order, but you should be impressed. You should learn that you need to, it is for your good. So if you have to brush your teeth, you have to know it and what will happen to it. Okay, so here we are going to go through some of this traffic signals. So in the highway of oral health, it is just not the parent and the child, but also we as health workers, we are there with you, and you are at the apex of the triangle. And it is not only one way, we are not ordering you. It will be the complete team approach, and we will definitely consider you as what you want. Now, you all know why you should understand why. What happens? You don't want to enter. There's a signal very, very clear in the traffic. Do not enter this road. What is that road? Into the gum disease. If you go into that road, maybe it is a blocked road, or it is going to be a dirty road, or it's under repair. So you don't want to get into that. Now, how does that happen? You have to understand how I should not enter into the gum disease. I should not go into that road. Okay. Now that is, the sugar is one of the culprits which causes problems for the oral health. Sugar in the presence of bacteria, the germs in your mouth, form a deposit. This is called as plaque. This plaque again irritates the gum due to the acid formation, which causes and irritates and causes swelling of the gums. Okay, the swelling is called as gingivitis or gum disease. Okay, and this gum disease causes bleeding. It doesn't stop there. It doesn't stop even after bleeding. It starts, the gums goes into the bone, and the bone support, which is called as periodontal ligament, periodontium, supporting structure of the tooth. Okay, you would have read the parts of the tooth. Tooth has got gums and supporting structure, which is called as periodontium, becomes loosened, and the tooth starts shaking. And all these problems can start very early in life, right from the 12 years of life. Okay, so if it is neglected, right from 12 years, this gum problems can set in. Yes, even earlier also there can be gum problem, but shaking of the teeth will start even right from 12 years. And as you advance, you may lose the teeth early in life, by 30 years itself, the teeth will start shaking, 30 to 40 years. So if you maintain and get the gums cleaned, it would be better. Now, and if you leave it, what happens? How does this deposits, which is plaque, it becomes hard mineralized structure around the teeth, and that is called as calculus. Now, how should you clean it? You should use a toothbrush and a fluoride containing toothpaste. Now, why fluoride? Fluoride has got a mineral which is part and parcel of your tooth. The tooth is containing calcium, phosphate, and fluoride in it. Okay, fluoride is a very hard, it hardens the tooth, and it is also reduces, whenever it is there, it reduces the acidic challenge. So that is why a toothpaste containing fluoride would be better than non-fluoridated toothpaste. Now, you have to use it for twice a day. It's very important. Now, you should start toothbrushing. Method is particularly for children. I'm sure all of you would have filled the questionnaire which was sent to you. Some of you would have said that you will brush horizontally, front and back, up and down, like that. But now let me tell you, if you have been doing that in the past, it's okay, don't worry about it. But the best brushing method for children we recommend at JSS is using small circular motion. Okay, you can now. Okay, this is what, it's quite scary, this is what is there. After you have a meal, you will have this, this is, of course, we have used a coloring agent, which is called as disclosing solution. This is a method we educate the patient and the child that what a deposit is, what a dental plaque is. It's most of the time invisible to your eyes. You don't, after a meal, definitely each one of us will have this. That is why you have to rinse your mouth. But yes, ideal would be to brush your teeth 3 times a day after every meal. But since midday meal, you cannot take your brush to the school, at least rinse your mouth well. And of course, you know that some people still follow digital brushing. Yes, it is not harmful at all, even if you can use your finger for digitally removing this. So what you are seeing, a deep red color here, is that food deposits which are formed within few seconds after your meal. And this is what it looks like. Okay, and if you leave like this for weeks together, it starts accumulating. Now, upper and lower, one very important step is many people keep the teeth together, upper and lower jaw tightly closed and brush. That is wrong. You should keep the upper and lower teeth separate when you are brushing. Now, how much amount of toothpaste should you use? The children below 5 years should use only peanut size as you can, because more than that, you cannot keep in the mouth, so you will immediately spit out, and it is maybe if the child is accidentally swallowing, it will be harmful. If the parents who are listening here, please take care of this, that you are not supposed to use. I'm sure in the brush toothpaste, it is written how much you should use. And for 5 to 12 years, half the size of the brush is more than enough. No need to use full. Even that also for the safety reason. And because most of the time, if you put it there, by the time you take it, half of the paste would fall down, or you, as the patient would, one is he may swallow off, or he may want to spit out immediately. And coming to the about 12 years, children can use full length of the brush of the paste. And here you will be a short video. I'm sure you will appreciate. So very important is you should wash your toothbrush with water, so that when you put the toothpaste, it sticks to it. Many people put the paste on it and then wash it. So what happens? The paste would fall. Here you can see this is a simulation. You can see you have to keep the brush at 90 or maybe around 70 degree against the teeth. Make small circles, start from the front teeth, go around, all around, at least 2-3 circles at every area. Turn the brush around, particularly children, they forget which side they brush. So this is a method which we have developed, which is easily practicable. And parents and children, once you learn this method, you will not forget it and you will not miss. You see this continuously, the brush is moving from all sides and in a round way. And when you come to the front, it was a little bit of scrubbing movement, round circular movement. It's very comfortable, not at all painful, whether you have healthy teeth or whether you have bad teeth with a decay. It will not hurt your teeth at all. When you do horizontal movement and when you do up and down movement, of course, that is practiced by adults. Okay. Similarly, lower teeth also. Okay. Now here I have not put the paste because this is a model. Otherwise, paste you will not be able to appreciate. I'm not telling you to brush without the paste. Okay. You see how we turn the brush. Now, why we tell this? So that because your mind is so occupied. Even while brushing, you are thinking what examination is there today, what I have to read today, or what is the food today. So you don't give attention to what you are doing, where you are doing, isn't it? So that is why develop a habit that you go in a sequence, that you always want to, where when you wear a dress, you know what you want to do first, right? Okay. So follow a sequence, and that will make you not miss any other area. You practice this today itself so that you will remember. And if you are forgetting this and you want to show to your other family members at home, you can always access this video again from YouTube. I'm sure it will be loaded. Lastly, you should not forget to clean the top surfaces of the teeth. That is called eating surfaces of the teeth. That is where the food gets stuck, and this you can do a horizontal front and back action. I hope video was clear. Now coming to the one more condition. Yes, the gum disease is reversible, but decay is not reversible. Remember that if once a dental decay is formed, it is a one-way traffic. It will process, and only you can fill it up. You cannot make the tooth back normal. So do you want that to happen? No, but you can prevent it before it starts. Even there, it's a sugar which acts on the bacteria, which forms the acid. This acid acts on the mineral. This is called as a chemical reaction. Many people, we blame only the bacteria. Oh, germs is causing. Germ is causing, but what is it forming? It's forming an acid, and this acid is acting on a tooth, which is a mineral structure. It is falling on a mineral structure. Tooth is calcium phosphate, hydroxyapatite we call it. And acid, that too, when the acid formation is, bacteria develop acid, and the amount of acid formed is pH is 5.2. And this 5.2 acid remains in the mouth for 15 minutes. In the mouth, it can start this process of dental decay. So you understand, it is all the concepts. So from where does this sugar come from? It comes from the food. Now food doesn't, now what is this sugar? Sugar doesn't mean when you add sugar to it. Anything sweet is sugar, okay? Even carbohydrate, your rice contains sugar in it, okay? There is monosaccharides, disaccharides, they are also end product, they also develop sugars. Sugar doesn't mean the raw sugar, okay? Not only chocolates. What are sugars? Sugars are called as hidden sugars. Hidden sugars are there even in your medicine. So even after a medicine, you should rinse your mouth. Even your cake and biscuit, everything is sugar. There is a sugar in it. So sweetened, anything sweetened. So here we tell you in the term of sugar, but anything sweet, anything carbohydrate can break down to sugar, and which is harmful for your teeth. So even if you are a rice eater, ensure that you rinse your mouth. And this is just to show you the parts, the enamel, the outermost layer of the tooth, and the dentine is the second layer. And the third one is the pulp, which carries the blood circulation and the nerve endings. And the lower part of the tooth is the root, okay? And this black portion, what you can see is the cavity. As the cavity advances, it will be first a small cavity. It can come from the top surfaces or in between surfaces. And then as it advances, it goes to the nerve. And as it goes to the pulp, the innermost, I should not say the nerve, it is called as a pulp. Pulp is it carries the nerve endings from the main nerve supply to the face, which is connected to the cranium, to the whole nervous system of the body. Okay, so that is why when you get pain, it goes through this nerve endings through the pulp, and it goes to the main nervous, and that is how you feel the pain. So I'm sure you don't want that to happen. So this is again a picture. You can see when you come to us early, these brown portions are all decay because of the acid formation on the deposits. Yes, if you come to us, we can build up this cosmetic fillings there. Can it be possible to two-way? Yes, it is possible, but before the whole cavity holes are formed, there is a possibility that we can avoid restoring. Okay, otherwise restoration is the only way. At least I don't want. I'm now 58 years old. I did not have a cavity filling until the last 3 years. So I managed to keep my teeth clean without filling. That is the success story of how you care for your teeth, okay? And now also, when I developed a cavity, it was a small age-related cavity, because as the teeth wears out, there can be some cavity formation which are not in your hands. Okay, so, and if you neglect, you know the danger zone, you don't want to go there. Okay, if it advances further, tooth breaks down totally, then you need to remove the tooth, and that is the danger. So please do not go. Look at this advanced condition. These type of conditions will create irreversible damage, and out of this 2 teeth will be not safe. And look at this, still more advanced. This is child mouth here we are showing you. Okay, now what about, we were talking about sugars. Now, how many times you can eat? Yes, when I say sugars, doesn't mean take a lollipop or a chocolate and have 3 times a day. Anything sweet, okay? It may be a biscuit, it may be a cake, it may be anything home dish, sweet dish in your house. It should be 3. And out of this 3, ensure that 2 of them are along with the meals. Like, even having a cup of milk is a sugar exposure. Remember, the liquid sugar is a sugar exposure. Now, sir, how can I eat biscuit? Then you eat it together. Have a biscuit and milk together. You are having a cake and milk, have it together. Then it will be considered as one. You should never eat every 1 hour. If you want to have a biscuit, you want to have a cake, you want to have a milk, which all 3, eat it together 1 time. Then it will be considered as one-time exposure. If you eat it after every 1 hour spaced, then it will be bad. Now, you may have a banana, you may have a gulab jamun, but eat it together. Now, how fast? You'll say, how can I do this combination? I don't feel like enjoying it. Yes, but within the first 15 minutes, you should finish it off with a gap of 5 minutes. So when I told you, once an acid is formed, it's working for 15 minutes. Now, if you keep eating after every 1 hour, once anything sweet, so you are developing an acid formation. And next, never eat sticky and clinky food. If you are really eating sticky and clinky food and that too sweets, you will have to be careful. Follow this chart of signals. You know what is red, yellow, and go in the roadside traffic. Okay. Yes. Those who are vegetarians, yes, you can follow the vegetarian, and those who are meat eaters, it is having a no restriction. Fat products also is okay, but what you need to avoid totally, you have to keep account of this. Okay, we are not telling to stop totally. Yes, we do tell to stop totally also in cases where there is terrible cases. So this is again just to show you what you can do as a dental professional. When you're deep cavities, we do a temporary filling, we give you a built up like this, and you use very nice thin instruments. See, dentistry, you may say, oh my God, you need to, health worker, you have to work in the mouth, so mouth is so dirty. All instruments are there, okay? Where instruments, you will be working in a very high level instrument and giving the beautiful smile here. You can see this. These are the steps. This is a drill which you can see with a drill, with a high-ended drill which reduces, and these are the instruments, how you pack, and you can beautifully, if you can do this sculpture work, okay, in a beautiful way, you can, and make the shape of the tooth, the lost structure. You can see that the tooth structure was lost, and here how beautifully it has been come. The front teeth, nobody would like to have this. Today, even a child, I have a child who comes to my clinic from not one patient, I have many children, I would say, at the age of 3 years, and he doesn't like to have this. He wants it every time. Yes, always there will be a need to redo it, because some of the fillings may keep on breaking down, and then we need to replace. Now, this is an advanced condition here. I'm sure you don't want this. And if you have this type of condition, you have to undergo removing, and then we give a replacement of teeth. And sometimes even we give crowns. This is called as crowns, okay? And this is the root canal treatment. As you can see in the lower x-rays, you can see there is root canal. Root canal treatment is when the infection is going below the roots. And if the tooth has to be removed, as I said, you have to replace the teeth, or we may have to give some device like this to hold the space. If you don't hold the space, there will be a problem, and you can land up into the crowding of teeth. Then later it becomes very expensive to treat, more than 30 to 40,000 rupees. It will cost you to get these teeth fixed back again. Whereas at the early age, you may get treatment for just for 2,000 or 3,000 when you have to give these type of devices. So this is again a condition. You can see how bad the condition was, and after treatment, this is before and after. And even the back teeth, you can see such badly broken down teeth. Yes, you need to go to a specialist in some cases, because some of the treatments are not possible by general dentists. So there you need to dentist, then they can fill it up. There will always be variation between the two doctors because of limitations of the training. Okay, and there are some devices like this, clips treatments, we call it, replacements. Okay. So all these are very comfortable. These are all images of children. So children, please if you have got any fear in your mind, please remove the fear. You go to your right dentist who treats children, and you will definitely be very comfortable, and you will have care to retain your condition in such a way that when you grow up, you will have a nice set of teeth. And today you have that type of importance. With this, I request all of you after this talk to fill up second time, we will be sending the post-test Google form. And with this, I end up my talk, and there's again a video going on. And this is also a story form we had developed for some children to follow, very young children below 8 years. They understand what is good for the teeth and a happy and an unhappy king. So I will share this to your school so that this type of a story can be explained to make them. And we are very proud that our former president, Shri Abdul Kalam ji, also visited our campus several times, out of which one of the time he interacted with the children who were from JSS school. And I'm here along with that, he also interacted with the children who were going towards the path of improving the clinical success. We have our leaders who guide us all the time. Thank you for listening to my talk. I'm sure you're inspired. Every good monument, once in a while, even in the best of the things, needs some restoration. So today you are dealing with a challenge. The future of dentistry is great, because I would say that I'm sure everybody wants to have the best of the healthcare, and teeth are the most visible, improves the personality and confidence level and successful. And in USA, the highest paid professionals are dentists, both in academic situation and in clinical practice. Thank you, madam. Thank you all children. I hope you enjoyed. If I've spoken quite a lot and bored you, and I'm sure you will have dreams of dentistry today. Please don't get scared of it. And you can always come back to us. You can visit us. Parents, if you have questions, they can always put on the chat box. And as time permits, I will reply to them. Thank you. I thank the organizers. I thank the madam for giving this wonderful platform, Geetika madam, for giving this opportunity. And I thank our organizing IT section, Sumok particularly, who is our IT backing. He was busy today, and he himself is a dentist, and he is also now in multifaceted role. He is helping in IT activities. You can see dentists can play multiple roles. Okay. Thank you again.
Thank you, sir.
Thank you very much, sir. It was a wonderful and inspirational speech or words, and hope our children will take up very seriously, because a smile on your face always shows how confident you are. So we have to take care of our teeth. So the best way is we have a lot of technology has been improved, and we have a lot of facilities right now. So children, don't be scared. If you have any problem related to dentist, you are free to approach our JSS school, Mysuru, this one. Now we are very free with Nandlal sir. So I think you can go straight and say that we had a session with sir, and sir has told anytime you can come here and get your teeth checkup. So I hope children will take up very seriously about this. And we had a nice session, sir. Thank you, sir. Thank you on behalf of JSS HSR layout. And thank you, sir. Once again.
Do you want any of the one child to speak if they want to?
Yes, let me ask.
If any one child wants to speak, just in general.
Let them raise their hand, no? Yes, and yes.
Hello, sir. My name is Samarth. Actually, I thought about being a dentist, sir, but I also thought about you. So actually, you have worked very hard. So when my ma'am told to create a PPT, I was very worried. You create such a good PPT, sir, and such a nice explanation you gave. I'm actually very impressed, sir. And I also want to think about being a dentist.
Dentist.
Okay, Samarth, very nice. Nice to hear that. I hope all of them, because sometimes when because I'm a pediatric dentist, I was able to, we have to talk to children, particularly of all the grades. So normally I have talks for children below 6 years, 6 to 8 years, and 8 to 12 years. and about, separate way of talking. So I have mixed up and spoken so that all can understand. And I didn't want to scare too much to the younger children. Anyway, great to hear. I hope you all enjoyed. Have a nice day. And I had a lot of other videos, but then I know you have other priorities of learning. So I'm sure you know what dentistry is about, and particularly what a pediatric dentist also called as pedodontist. So madam introduced me as a pedodontist because we got a degree of pedodontics. But now they have changed the terminology to pediatric dentistry. So if in your city you see pedodontist, it is the same person, pedodontist, okay? Or it is pediatric dentist, or a pediatric dentistry, or dentist for children, okay? All these are same. So look for that if you need a special care, okay? But yes, general dentists also, some of them, they call super specialists there. Okay, we are not trying to promote specialty, but if you, some conditions are not treatable by general dentists, okay?
So
Okay.
looking forward, sir, for your still more sessions, because we had a very nice interaction with you, and hope still we'll go very depth of individual this one in the next coming sessions, sir.
Sure,
We are
madam.
looking forward.
Annually, we can plan this with a
Yes.
follow. Yeah.
No, this is the first step. We have started webinars every Saturdays this year. So hope
Okay.
we'll continue this. Yes, sir.
Yeah, it's lunchtime now. I'm sure children are eager to have lunch. Okay.
Yes, sir.
Very
Thank
thank you, children and parents who have permitted them to sit quietly with me to listen to this. It is left to the parents to guide you further. I would say, not that I'm trying to say dentistry is the ultimate. Some of the parents would like the children to become guide you for other professional courses. So it's left to you, and take a call on that. Thank you. So we'll